Alrighty, folks, a very good morning to you. Welcome to another edition of the Health Way. It's a Tuesday. You know where we're going to Tuesday? We go to the dentist. With us this morning is Dr. Dayna from Pure Smiles. Dr. Dayna, how are you?
Good morning. I'm doing well. How are you?
I'm good, and we're live on Facebook, live on YouTube. So
Good
you're going to be able
morning.
to
Good
jump
morning,
on.
everyone.
Great. Now, today we're talking about osteoporosis and oral health.
Mhm.
Yeah, now it's important to let your dentist know all about the medications that you take. That's because certain medications can influence dental treatment decisions. What say you, Dr. Dana?
Okay, so first, before we get into osteoporosis and oral health, I know some of you may be like, what's osteoporosis?
Right,
Okay.
right.
So, osteoporosis is a disease that weakens the bones to the point where they break easily. So,
Mm,
I know, I mean, mainly you probably hear like your grandmas talking about, they have osteoporosis and they break their hip or they break their leg. But most often it's the hip bone, the backbone, and the wrist.
mm,
So it's also called like a silent disease because you may not notice it until your bone actually breaks.
mm.
So that's why it's important for you to take your calcium when you're young, take your supplement. Chevauni laughing because I know Chevauni sometimes don't take those supplements.
You're going to call me out, right?
Yes.
Yeah.
So then you have osteoporosis and then you have osteonecrosis, which is what we're going to get into,
Mhm,
where there is necrosis or like death. It's really just death of the bone cells. That's what osteonecrosis is.
mm,
So if the process involves the bone near a joint, it often leads to the collapse of the joint or subsequent arthritis. So the treatment for that would usually be just joint replacement. Um,
mm,
so just for that overview, and now we can talk about osteoporosis and oral health. So the most common thing that we see in the
mhm.
dental office is osteonecrosis of the jawbone.
Got you.
Um, right. So if you're taking medications such as Fosamax or Bonivia or any anti-resorptive type of agent that helps to treat the thinning of your bone, then
Mhm.
you need to let your dentist know.
Mm. All right. Now, with that said, how do these medications affect dental treatment plans?
Okay. So it's important because we would know that we have to make sure that you have good oral health going into the treatment.
Mhm.
So we have to be very careful to ensure that you're not having any infections. If you are doing any extractions, we need to know because it's going to be more easy, no, as I was say, easy and susceptible in the same word. So you're going to be more susceptible to getting osteonecrosis, right? So
Right.
if we are going to do an extraction, which is taking out your tooth, that
Mhm.
can affect the bone and the healing of the bone, right? If you have osteoporosis, right, the bone may heal a little slower, or you may end up with an infection as it is healing. So osteonecrosis of the jaw can occur spontaneously, but it's most common after dental extractions.
Mm. And it's not possible to say who will develop it and who will not, right?
No, it's not possible. So most people, more than 90% of the people are diagnosed with osteonecrosis are the ones who are taking the medications. We just only mentioned a few earlier, but
Mhm.
also persons who are taking medication, patients who have cancer or are receiving higher doses of these anti-resorptive medications. So those are the medications that help to prevent the thinning of the bone.
Mm. And with this, they must continue to visit your office, right? So regular checkups. Yeah.
Right. So we are going to be working, we would be working very closely with their medical doctor. So it's important also for you to let your medical doctor know if you're going to visit the dentist, if you have a tooth to take out. We, the dentist, we're going to reach out to the doctor to find out. So we'll probably send you with a referral or a letter to see if the doctor is okay with us doing the extraction at this time or any further treatment at this time. If you have any oral surgery to do, any further oral surgery to do.
Mm. Wow, somebody says on YouTube, oh my, that sounds serious. Yeah,
Yes,
it
it
sounds
is serious.
serious. Mm.
It is serious, and any underlying condition that you do have, it's very important for you to let your dentist know, because there are a lot of complications that can occur. So a lot of people think that, okay, when I'm just coming to the dentist to fill, to clean, to take out my teeth.
Mm.
But I mean, even with high blood pressure, if your pressure is high, we can't take out your tooth because we're going to have to give you some anesthetic, and then you may end up getting a stroke in the chair, right? So some
Mm.
people take it for granted that it's just teeth, but we care about your overall health also. So you
Mm.
want to make sure that you continue with your regular dental visits along the way.
Yeah. What about those who are dealing with or doing cancer treatment? What should they do?
Okay, so if we have a patient who's undergoing cancer treatment, we try to avoid invasive dental treatments if possible.
Mm.
So we, at that point, we are only taking instructions from the medical doctor. So if the cancer patient comes in on their own, we are still going to consult their doctor, because we need to know, if it's okay for them to do this treatment while they're receiving chemotherapy or radiation. So we try to keep the treatments minimally invasive, and only the treatments that are a must. And when I say a must, it means like if we want to minimize the amount of bacteria in that patient's mouth before they undergo the treatment,
Right.
right? So in those cases, a must may be even something simple as a cleaning,
Mhm.
or it may be something as for an extraction.
Right. And it's also important that you talk to your physician before ending medications.
Yes,
Hmm.
yes, and we will also be consulting closely with the physician.
Hmm. Great. Let's go through some symptoms of some of the things we're going through, and I gather they're not limited, but we'll make mention of them.
Yes. So osteonecrosis, some of the symptoms include pain.
Hmm.
And pain is a good thing because that means your body is working.
Right.
Okay. I know a lot of times people think, oh my gosh, why am I feeling pain?
No
That's
pain, no
great.
gain.
Great that you're feeling pain. That means your body is responding to let you know that something is wrong,
Yeah.
right? You may have swelling, you may have infections of the gum or of the jaw, especially if you had a recently treated gum area and it's not healing well, then you want to pay attention to that, okay? You may have loose teeth. You may feel numbness in your, or like a heavy feeling. I don't know how many of you have ever taken a tooth out or done a filling and your face feels like half of your face feels like it fell off. That's how it's gonna feel. Or in some cases, people have exposed bone. So you're actually seeing the bone being exposed.
Really?
Right.
Oh.
So and those are in some extreme cases. So if you are having any of these symptoms, and this is not a situation like when you go on Google and you see all the symptoms and you're like, oh my gosh, am I dying? If you have osteoporosis and you notice these symptoms and you've recently had dental treatment, you want to contact your dentist, you want to contact your physician. And if you are a cancer patient and you're also taking these types of medication, you also want to contact your oncologist right away, so that so if any of these symptoms develop after dental treatment, that it can be attended to. It's very important. Don't sit and don't just sit on it.
So the exposed bone, is it uncomfortable? Like, is it out? Like, is it pushing out?
So what happens is that sometimes the flesh is actually gone. It's eaten away. So necrosis, remember before I said necrosis is the death
Mhm.
the death of cells, right?
Right.
So sometimes that's what happens, but that's in extreme cases. That's if the infection has gotten really bad.
Someone on YouTube says drastic. Oh my. All right. I think that's where we can leave it for today. It's quite a mouthful. Osteoporosis and oral health. How can we find you again, Dr. Dayna?
You can find me at 88 Barbican Road, Unit 12, Barbican Business Center. You can find us online at puresmilesjamaica.com and on social media at Pure Smiles JA and the Preaching Dentist. And remember to keep listening and paying attention this month because at the end of the month, we have a gift basket courtesy of Lasco that we
Ah,
in a way. And it is also the first year anniversary of my book. And so we will also be giving away a devotional along with the basket at the end of the month.
sounds
Maybe
interesting.
two separate days though, two separate days so that two separate people can get something.
Good.
So make sure you're listening and paying attention.
Yeah. Thanks, Dr. Dana. Thanks as always, my friend. Appreciate it and keep safe. All
Thank
right.
you for having me. Be safe.
Great. Thank you,
Bye.
listeners. Lindsay's on. Hi, Lindsay. I see
Bye.
Lindsay. Great. Thanks,
Okay.
everybody. Big thanks for stopping by inside the Health Way today. Brought to you by the Ministry of Health and Wellness, providing opportunity, stability, and social protection. We catch you again tomorrow for another interesting feature right here inside the Health Way. This is Love 101 FM, and it is the family station.
The next person in line, your friend at school or your coworker may have COVID-19 and not know because they have no symptoms. You, on the other hand, could be hospitalized for 2 months or more if you become infected.